Hi, my name is Diane and I'm a registered nurse. I deal with spinal cord injury patients and I have a program which I would like to introduce to you to give you some background information. It's called the Pressure Ulcer Prevention Program for Spinal Cord Injury Patients. The first thing that I would like to talk about is inspection. We need to inspect the skin of the spinal cord patient secondary to a higher risk for skin breakdown. As you know, with the spinal cord patient, with the paralysis, they are unable to do weight shifts and also reposition themselves for a higher risk of skin breakdown. So to begin with, we're going to do the inspection process. We want to make sure that every area, the coccyx, the ischial area, also the scapula areas, any pressure points that are higher likely to have skin breakdown, these areas need to be inspected. Going to weight shifts. Weight shifts with a paraplegic, they are usually in their wheelchair anywhere from 12 to 14 hours a day, sometimes longer. With that being said, what we need to do is to instruct the patients on how to do weight shifts or their caretaker to do weight shifts in their wheelchair in order for them to prevent skin breakdown. And this is something that I will have a number at the end of this interview, so that this way you can call this 1-800 number, Pressure, in order to get further information on how to do weight shifts in a wheelchair. We also look at nutrition. Nutrition is very important in order to maintain your skin integrity. So with the nutrition, a nutritionist will also be involved in the care of the spinal cord patient. We also have to make sure that we increase their protein intake in order for this to occur. Also with the paraplegic, they are on bowel routines. Bowel routines consist of assisting the patient with medication in order to have their daily bowel movements. With this, what we need to do is to make sure after the bowel routine that their skin is dry and intact with each bowel routine. With that washing, also with putting cream that is applicable to the sacral area status post the bowel routine. Also, repositioning. Repositioning is very important, especially with the paraplegic at nighttime. They cannot stay in one position longer than 2 hours without the higher risk of skin breakdown occurring. These areas that usually occur is the coccyx area, sacral area, or the ischial area. So with that, we have to make sure that the paraplegic is repositioned at least every 2 hours to alleviate the pressure on the high risk areas. Also, I would like to educate the caregivers. Usually the caregivers are the ones of the first line of defense in helping the paraplegic to reduce skin breakdown. So with the at the end of this interview, again, I will tell you to call 1-800 relieve pressure in order to educate the caregivers with a pamphlet. If you would like any other information, again, call 1-800 pressure, and I will be more than happy to send you free information and a video in regard to maintaining skin integrity and reducing pressure ulcers for the paraplegic. Thank you.